Hello, I'm Sarah Carlson from St. Mary's Hospital. I'm here to talk to you about advance directives. During the course of this program, I will explain what advance directives are, and I will go over how to fill out an advance directive. An advance directive allows you to make your wishes clear to your family, friends, and healthcare professionals about what kind of medical care you want if you become seriously ill. It helps prevent disagreements among your family members about what care you should receive if you are incapacitated. If you do not have an advance directive and you are incapacitated, no one has the legal authority to make your decisions. Without an advance directive, your family may need to spend time and money seeking guardianship in court in order to make decisions on your behalf. The time to fill out an advance directive is now. There are two kinds of medical advance directives, the power of attorney for health care and the declaration to physicians, which is also known as a living will. The power of attorney for health care is a more powerful and flexible document which takes precedence over the living will. For the purpose of this video, we will review the power of attorney for health care and give you instructions on how to complete the form. If you do not already have a power of attorney for health care form, please pause this program and ask your nurse for a copy of one. A power of attorney for health care allows you to name someone to be your healthcare decision maker or agent if you become unable to make your own healthcare decisions. You should choose someone whom you trust and who has a good understanding of your treatment preferences. Remember, this person will have the authority to make important healthcare decisions on your behalf if you become incapacitated. Most commonly, people choose a close family member or trusted friend to serve as their agent. Also remember that this form pertains to medical decisions only and does not apply to financial decisions. We will now turn our attention to the actual power of attorney for healthcare document. Again, if you do not have a form, please contact your nurse to provide you with your own copy. Please follow along as each section is explained. Note that the document starts with an area to fill in the date that you complete your power of attorney. There are several places on the form that need to be dated, and all of the dates should match. The validity of a power of attorney can be called into question if any of the dates are not the same. The first three blank lines of the form are where you print your name, address, and date of birth. Next, under the Designation of Healthcare Agent section, there are two separate blank spaces. This is the section in which you designate who you want to make medical decisions for you if you become incapacitated. For the purpose of filling out this form, incapacity is determined when two physicians or a physician and a psychologist examine you and determine that you are unable to make healthcare decisions. Remember, you will continue to make your own medical decisions until you are declared incapacitated. In the first set of lines, you should put the name, address, and phone number of your primary agent. In the second set of lines, you may designate someone to serve as an alternate agent if your primary agent is ever unable or unwilling to serve as your decision maker. Please note, you cannot name your physician or other healthcare provider unless they are also related to you. Your healthcare agent will work with your physician to make your healthcare preferences known. The sections labeled General Statement of Authority Granted and Limitations on Mental Health Treatment explain that your agent has the power to make any medical decision for you. It is your agent's responsibility to fully understand what your preferences are and to follow through on what you would want if you are unable to express these desires yourself. However, your agent cannot make decisions about mental health treatment, such as an admission to a psychiatric unit. As stated, my healthcare agent may not admit or commit me on an inpatient basis to an institution for mental diseases, an intermediate care facility for the mentally retarded, a state treatment facility, or a treatment facility. My healthcare agent may not consent to experimental mental health research or psychosurgery, electroconvulsive treatment, or drastic mental health treatment procedures for me. In the next section, admission to nursing homes or community-based residential facilities, you state whether or not you trust your agent to make a decision about admitting you to a nursing home or community-based residential facility for long-term care. Your agent will automatically have the power to admit you to such facilities for short-term care. If you answer yes, your agent can also admit you for a long-term stay. If you check no and your needs were such that you required long-term care in a facility, your family or agent would need to petition the court to be named as your guardian in order to make this decision. This will involve legal fees and would mean that the court would have oversight over where you are placed. Remember, the question is not whether or not you want this type of care, but rather, do you trust your agent to make this decision should you need this type of care? In the next section, labeled Provision of Feeding Tube, you may designate whether or not your agent has the ability to make decisions about withholding or withdrawing a feeding tube. If you check yes, your agent will have the ability to make decisions according to your wishes about withholding or withdrawing a feeding tube. If you check no, no one has the ability to withhold or withdraw a feeding tube from you. It is important to have a thorough discussion with your agents about how you feel about feeding tubes and when you may want or not want a feeding tube. Again, the question is not if you want a feeding tube placed or removed, but rather, do you trust your agent to make this decision? Next, under healthcare decisions for pregnant women, you may give your agent the ability to continue to make healthcare decisions for you if you are pregnant and incapacitated. If this question does not apply to you, you can write "not applicable" next to this section. The Statement of Desires, Special Provisions, or Limitations is a place where you can express, in your own words, your thoughts and wishes regarding your health care. This section could include thoughts about quality of life or how you feel about life-sustaining procedures in the face of an incurable illness. You may also choose to leave this section blank. The last section, which is titled Inspection and Disclosure of Information Relating to My Physical or Mental Health, makes it clear that your agent has the right to have access to your medical record. When you are ready to sign your Power of Attorney for Healthcare form, it should be witnessed by two people not related to you by blood or marriage. The witnesses cannot be nurses or doctors providing your care. You and your two witnesses should sign the document at the same time, and all the dates on the document must match. If the dates do not, the document is considered invalid and must be completed again. Your healthcare agents may sign in the appropriate blank under the Statement of Healthcare Agent and Alternate Healthcare Agent section. Your agent's signatures do not need to be witnessed, and your agents may sign on a different day. Their signatures are not necessary for the document to be considered valid. This completes the essential parts of the Power of Attorney for Healthcare document. Note that there are two optional sections included for your consideration. The first is a section about organ donation, which would allow you to state your preferences about organ donation. The second is an optional addendum that can further explain your preferences about what type of healthcare you would want if you had a terminal condition, were in a persistent vegetative state, or had advanced dementia or other like incapacities. In the addendum, you state your preference about what specific medical care you would want by agreeing or disagreeing with a series of statements. The purpose of the addendum is to provide further guidance to your healthcare agent and medical providers. Because these sections are optional, you may choose not to complete them. If you do choose to complete the addendum, you must sign it in the presence of two witnesses not related to you by blood or marriage. You may use the same witnesses you used to sign your Power of Attorney for Healthcare document. We hope this program offered you the information you need to feel empowered to complete an advance directive. If you have additional questions or need help completing your form, please have your nurse contact Patient and Family Services or Pastoral Care for further assistance. You may also contact these departments yourself by calling the extensions listed on the screen. Thank you.